Hi, I'm Valerie Akerson with the St. Louis Fetal Care Institute. Today we're going to be talking about postpartum psychosis, which can be a difficult subject. I do want to stress that if you are having thoughts of hurting yourself or hurting someone else, to please go directly to an emergency room. Postpartum psychosis affects 1 or 2 out of every 100 women. And in those women, there's a 5% suicide rate and a 4 to 5% infanticide rate, meaning a killing of their baby. Postpartum psychosis is rare in terms of other perinatal mental health disorders. The onset is usually within the first 2 weeks of birth, but it can occur up to a year later. Some risk factors are your first baby, any OB complications, perinatal or neonatal loss, a diagnosis of bipolar disorder, an episode of previous psychosis, a family history of psychosis, and sleep deprivation. Postpartum psychosis presents as a true break from reality, feeling disoriented, aloof, unable to care for yourself, or you can have an elated mood with rambling speech, delusions, hallucinations, visual and/or auditory, visual meaning seeing things, auditory meaning hearing things. In those moments, you feel that those thoughts are true or that they're normal. The only treatment for postpartum psychosis is hospitalization. It is a true emergency. This can and has led to the death of children. Postpartum psychosis is different than postpartum depression. Postpartum depression affects 1 out of every 7 women and up to 1 in 5 after 6 months. The onset is typically after 2 weeks postpartum. I often say if you feel like you're having more bad days than good days, it's likely time to consider a perinatal mental health disorder. Some of the symptoms of major depressive disorder are feeling overwhelmed, not connecting with your baby, unable to care for yourself or family members, feeling isolated, irritable, and this does often co-occur with postpartum anxiety. The number one indication for me is a woman who says, I just don't feel like myself, or my baby would be better off without me. Treatment for postpartum depression can include medication, therapy, and good social support. I want to turn to some unwanted, intrusive, or scary thoughts. There are reports that 88% of mothers experience these thoughts, and that number is likely even higher because that's a number based on self-report. Thoughts are thoughts. Thoughts do not equal action. The fact that you can describe them as unwanted and scary is the best indication you know you don't like how they make you feel. They make you want to change them. Thoughts can feel like they're flooding your brain at times, and then you have tremendous guilt over those thoughts. And you may take action to avoid harm or to minimize those triggers. Don't be afraid to ask for help. The silver lining of the pandemic has been that we are finally talking about mental health more. If you are wondering if you have a perinatal mental health disorder going on, odds are that you do. Reach out to your OB, find a therapist, surround yourself with social support. If you're having thoughts of harming yourself or someone else, go directly to an emergency room. Or if you're hearing voices or seeing things, go straight to an emergency room. Give yourself grace. You're not alone. To quote Postpartum Support International friends, you are not alone, you are not to blame, and with help, you will be well. Remember, we are always here to help. Thanks for watching.